topic that's going on right now, the coronavirus. It is crazy how the coronavirus started not too long ago, and now it's popping up everywhere, and it's really all over the news. So I wanted to talk to Amy about it because before Sometimes Spouse and Amy's Green Cleaning, you were a nurse, correct?
Yes, ma'am.
And what did you do? Were some places that you worked as a nurse?
Well, I've worked I've worked long-term care. I've worked acute care. I've worked in a surgical setting, in a clinic setting. I've really done it all.
Now, where was the favorite place that you ever worked at as a nurse?
Oh, that was the Lubbock Spine Institute.
Oh, why did you like it so much?
Well, it was very fast paced and it wasn't the same thing every day. We got to do in-office injections. I learned how to use an ultrasound machine. It was just so cool.
That sounds pretty fun. That's some of the just normal questions I ask Amy before we dive into the hard stuff like coronavirus. One more question for you. What's your favorite restaurant?
What city?
Lubbock.
Oh, Lubbock. Our favorite restaurant in Lubbock is Jazz. It's a Cajun, Louisiana type style. We go there all the time. I always get the blackened catfish. It is delicious. They have beignets, New Orleans style. Yeah, they're the best.
That sounds absolutely amazing. I love beignets. I haven't had one since I've been to New Orleans.
Well, we need to go to New Orleans.
We do. We need to plan a girls' trip.
I'm down. Well, we can't go to New Orleans just with us. We've got to have someone to protect us.
We've got to take the guys.
That's a scary place.
I've got lots of New Orleans stories I'll have to tell you. They have to be offline though.
Yeah, not while we're live.
Yeah, not live. So why do you enjoy the freedom and flexibility of owning your own businesses?
Because I am a workaholic, and I'm very good at no matter what I do. So I've been told every job I've been at, I've been promoted. My work ethic is very good. And so it's nice to be able to work hard and have it benefit me and my family, not someone who I never even see who lives in Dallas, Fort Worth and just owns the company. Because I know what I do, and to work for yourself and have it benefit yourself is really the best feeling, because you can work yourself to death at a regular 9-to-5 job and they're going to replace you as soon as you leave. You know, they really don't care about you. They do as long as you're there. But here, working for myself, I know I'm doing the right thing for my family.
Awesome. So let's get into this tough kind of topic that everybody's talking about. It's all over Facebook. It's all over the news. It's all over even TikTok and LinkedIn. Like, it is everywhere that you look. Everybody's talking about the coronavirus. Amy, what is the coronavirus?
So the coronavirus it actually comes from a family of viruses. And it is just a very strong antibiotic resistant virus. It's not normally found in humans, though. So that's the problem. It's normally found in animals, but it's never been confirmed in any human until now. And now it's a pandemic.
When did it really pop up? Was it a few months ago, or has it been around for years?
This strain was a few months ago.
Wow. So it's quick moving.
It's very quick moving. It's an epidemic. It really is. There's so many confirmed cases in almost every country and continent on the world except for Antarctica.
Wow.
And it is here in the United States now. It is here.
Is it in Texas?
So there haven't been any confirmed diagnosis of people that are from Texas, but there are people in Texas that are being quarantined.
Where are they quarantined at?
They are in San Antonio, I believe.
That's crazy.
Yeah, at an Air Force base. There's been 11 actually confirmed cases of the coronavirus in Texas. However, they are all instances of people that got the disease when they were overseas or traveling, and then they were just brought back to San Antonio for quarantine.
Is it spreading from person to person in Texas yet?
Not yet. So far, we haven't had any community diagnosis of it, but it is in Washington State, in that area.
Oh, wow.
Yeah, I believe the last report I read was there were 8 deaths in the Washington State area.
Wow. Last I heard, there was just one confirmed death. That was like at the first of the week. So that's crazy how rapidly it's spreading,
It is.
people.
You've got to wash those hands.
Yeah. How many cases are there in the United States? Do you know?
Um, Not off the top of my head. Do you have it pulled up?
I don't.
I don't remember.
It's just a handful, isn't it?
I believe it was there were more than here it is. There were more than 100 cases in the United States as of Monday evening. And I'm so sorry, it was 6 people that died from the virus in Washington State, not 8.
Wow.
But globally, more than 3,000 people have died and more than 90,000 people have the disease globally. So worldwide.
Wow. How is the coronavirus different than the flu?
So the coronavirus comes with seasonal flu-like symptoms, including fever, cough, shortness of breath, and difficulty breathing. So there are some similarities. Severe cases of the coronavirus, though not the flu, can lead to pneumonia, severe acute respiratory syndrome, which is SARS, and kidney failure. It can also be deadly for a small percentage of the population.
Wow. So you can die from the coronavirus, which is kind of like the flu, but way worse.
Yes, you definitely can die. It is fatal. And the scary thing is it is shown to be resistant to all treatments.
Really? So
Yeah, and they're working on a vaccine, but the vaccine is years away.
wow. Do you think that they can really contain it as far spread as it's getting now?
I think they can. I really think they can, especially the more they learn about it. With quarantine is going to be the main thing on containing it. You've got to be quarantined, and they're actually pushing to increase the quarantine to 2 weeks versus just the 10 days. So you've just got to be quarantined, stay away from those public places.
So what are the chances of fatality with the coronavirus?
Like I said, it is a small percentage that it can be deadly to. But there is a chance that you can die if you contract it. Um,
I think the flu is like 0.01% or something like that.
and the coronavirus is 3%.
Wow. So that is a lot higher, especially probably in newborns and the elderly or people that are immunocompromised.
And people that smoke and people that are susceptible to illnesses, definitely.
Now, one thing that we've really been talking about at Sometimes Spouse this week is ways to prevent it because we're in people's home and we're cleaning up after them. We're in businesses cleaning it up after them. So we've really been talking this week about ways to prevent the coronavirus. What are some ways to prevent it, Amy?
Well, the number one way you're going to prevent it is proper hand washing. And so for those of you that know how to wash your hands, are you washing them properly? That's going to be the number one defense in preventing the spread of this coronavirus. So the virus will stay on surfaces. It will stay on anything you touch. So if you touch a surface and then you touch your mouth or your eyes or your nose, you're possibly contaminating yourself. So I'm going to go over the proper way to wash your hands according to the CDC, the Center for Disease Control. So, for an adequate hand washing, you need to wet your hands with clean running water. You need to then turn off the tap because we're still trying to save water. Apply the soap, lather your hands together, anterior and posterior, your fingers, your fingernails, lather them together with the soap for 20 seconds. You can also sing the happy birthday song, the ABC song. It's all about the same length. And then you need to turn the tap back on and rinse your hands thoroughly. And then turn the tap off with your elbow or reach for a paper towel and dry your hand and turn the tap off with that paper towel in your hand. So you do not want to touch anything after you've already washed your hands because you will recontaminate yourself. And then on your way out of the bathroom, grab another paper towel and open the door.
What if you're in a public bathroom and they have those air dryers? I hate those.
I
How-
hate those too. Those harbor bacteria from what I read.
And like they blow around all kinds of materials. Do you
can
have
air
that?
well, you can air dry your hands. You can let them air dry.
Don't use your pants.
Don't use your pants. Don't use anything on your body because you're just recontaminating your freshly cleaned hands, Christy.
Good, good. What about if I'm out and about, like in Walmart or HEB or just shopping somewhere, and there isn't a way to wash my hands?
So there's hand sanitizer. And a lot of the stores have Purell wipes. They're sanitizing wipes. And I always wipe down the surface of the cart I'm going to touch. And then I use a clean one on my hands. And then I toss it. And I do the same thing when I'm exiting the store. But I don't know if you've read or not. There's kind of a shortage of hand sanitizer, Christy. Yeah.
Crazy.
So guess what I did?
What'd you do?
I made my own.
Wow. How do you make your own, Amy?
Well, Christy, let me tell you so you can make your own. You take a third a cup of aloe vera gel, which you can find that in the pharmacy section at CVS, Walmart, any local pharmacy.
Yeah.
And then you do 2/3 of a cup of rubbing alcohol, the 99%
Okay.
rubbing alcohol. And then you do 8 drops of your favorite essential oils. And then you blend it together till it's all blended nicely. And there's your hand sanitizer. And they even have the little plastic recyclable bottles to put it in with the squeeze tap at Walmart.
Wow. That's really handy because I mean, I know this is an epidemic and people are going out and buying all that stuff to prevent it so they can stay healthy.
So here's a funny story for you. You know Rachel. She was one of our housekeepers, and her family bought a new house outside of town, so she's not with us anymore. But congratulations to her. It's a big deal for her buying a house. Her mother lives in Amarillo, and she's a bit of a germaphobe already.
Uh-huh.
And so she texted Rachel the other day while we were eating lunch, and she says, "You know, Rachel, Walmart by my house was out of bleach and they were out of hand sanitizer, but it's okay. I found some at the Dollar Tree. So if you need to go to the Dollar Tree and stock up on that, prepare for the coronavirus." And then she sent her Psalms 91. And if you're familiar with that, it's just, do not fear because the Lord is with you.
Uh-huh.
So people are really freaking out about this coronavirus. They're buying up all the bleach. They're buying up all the hand sanitizer. And, you know, bleach isn't really what you need to do anyway. So,
Wow.
yeah.
What about that's hilarious. My mom would probably do the same thing if they ran out at her dollar store.
Yeah.
What about a mask? Do masks help at all?
Not really, because this is also spread through like respiratory droplets. And so it's kind of in the air when someone coughs or sneezes, and if they are infected. And the thing with the regular surgical mask that you can buy at pharmacies is they're not tightly fitted. So things are still going to go in, and those aren't necessarily made to keep infections out. You know, they're really made for surgical, for, you know, for sterile, so you don't breathe on anything.
Yeah.
They're not really going to keep air droplets out. You can get an N95 respirator mask. They are expensive. They have to be fitted to a right size. You have to be measured. But the World Health Organization is saying don't buy the mask. Just don't do it. It's not going to benefit you. They're not the right type of mask that you would need anyway. And all we're doing is making it harder for our healthcare professionals, our hospitals, our nursing homes to get those masks. We actually cleaned for one of the nurses who is a medical examiner, and she said they're already having issues getting masks.
Wow.
Yeah.
That's crazy. So there's lots of ways that you can prevent it just from the hand washing, hand sanitizing, and staying away from like large crowds.
Yeah, and I was listening to the radio the other day, and there are actually some places that are just, Mariah Carey is canceling her tours because, you don't want to be in an overpopulated area because you do not know who is contaminated. If
Yeah.
your children are sick, keep them home. If you feel like you're getting sick, stay home. We all have a social life, but now's not the time to be going to huge music concerts or big sporting events with thousands and thousands and thousands of people because you're just increasing your chances of contamination.
Do they know yet, like how long the contamination period is? Is it just when they have a fever, or is it while they've got the entire virus, or do they even know yet, Amy?
Well, they know a little bit about that. So the virus, it does stay in the incubation phase for a few days, even up to a week before you will become symptomatic. You can even have a negative test for it and still be in quarantine and then be tested again and then become positive. I was reading that one person had 2 negative tests, but he was still in quarantine because he had been to Asia. Um, Towards the end of his quarantine period, they retested him and he tested positive. So they're still trying to figure out the incubation period of this virus, but it does lay dormant before symptoms start showing up.
Wow, that is crazy. It sounds like it's one of those smart viruses.
It is, and it's just so deadly because it's never been found in humans before.
That's insane. Well, if anybody thinks that they have it, you definitely need to see a healthcare professional. You need to go and get checked out. They've now got a test for it, I believe. Uh,
Yeah,
so get tested and then stay away from people.
definitely. If you're having symptoms of fever, cough, shortness of breath, difficulty breathing, you definitely need to go get checked out for sure.
Yeah, because it can lead to something much worse. I think I read it could lead to pneumonia.
Well, pneumonia is the number one side effect of it in the mild to severe cases. But from the pneumonia, you can also get SARS, which is sudden acute respiratory syndrome. You can also get MERS, which is Middle Eastern respiratory syndrome. Um, Kidney failure. I mean, your organs can literally fail your body if you are infected with this virus and do not seek treatment. That it
Wow,
has a 3% fatality rate.
that's insane. And do you know if it's just hitting the elderly and young children, or is it getting
No,
people that are young and
it's
spry?
yeah, it's hitting it. It does not discriminate. Unfortunately, there are over 3,000 cases reported in Asia of people of all ages.
Wow, that is crazy. Well, I like to end the show with a funny question for you. So, Amy, if you had to choose from two superpowers, being invisible or flying, which would you choose and why?
I would be invisible because, oh my gosh, of all the inside information I could get, I would know everything. I would know exactly what's going on with the coronavirus right now.
You'd be at the CDC figuring it all out.
I would. I would just be sitting there. No one would even see me. I'd be like Harry Potter with my cloak of invisibility.
Well, Amy, if anybody wants to contact you, how can they get a hold of you? Because you are a sometime spouse handyman and household owner in the Lubbock, Texas area. And also you have Amy's Green Cleaning, which I personally use and I love. So tell us how we can get a hold of you, Amy.
So you can find me on Facebook. It is Sometime Spouse West Texas. You can give us a call at 806-476-0731.
Awesome. Well, thank you for enlightening us to what we need to look out for the coronavirus and how to prevent it. I am Christy Ogle with Sometime Spouse, and you've just joined us for the Ask Amy podcast. We are so excited that you joined us and keep tuning in. We've also got an Ask Amy page on Facebook that you can follow. And right now we've got some logos that we're getting ready to put up, and you guys are going to choose our logo for the Ask Amy podcast. So make sure and go to that Facebook page, like it, share it, and help us pick a logo. I'm Christy Ogle again. Thank you for joining us. Have an amazing day.